Hey, good evening, everyone, and welcome to another of our monthly Facebook live talk session. My name is Andrew, and I'm the head of fundraising, marketing, and volunteer management at 365 Cancer Prevention Society, and the host of tonight's session. Now, tonight's topic is to prevent, detect, and fight colon cancer, and it's kindly brought to you by 365 Cancer Prevention Society and our medical partner, OncoCare Cancer Centre. So please like and share right now and comment so that we know you guys are all ready for tonight's session, right? Now, and we still got some time, yeah? So please go and show your kaki, your friends, and everyone that you know, right, to join us for tonight's session, because it's definitely going to be a very informative and a useful session, right, for everyone. Now, so I know everyone tends to arm yourself with many questions for tonight's topics and also for our guest speakers for tonight. So may I appeal to all of you to hold your questions until the Q&A segment, right? We would have plenty of time, right, for you to pose your questions, right, to our guest speaker. Now, 365 Cancer Prevention Society was founded in 2003 as a social service agency with IPC status and is a full-fledged member of NCSS. The society's mission is to serve the community through holistic cancer prevention measures. This is accomplished through health and nutrition education, promotion of healthy lifestyles, and lymphatics detox exercise program. We also provide practical and emotional support and care for patients and their families in their battle against cancer through residential and hospital visitation, counseling, and wellness services. One is never alone in the fight against cancer, right? Just like every Liverpool fan knows, their team, you never walk alone, right? Likewise for us here. We hope you can join our community in our fight against cancer today. So for more information and to stay to date about 365 CPS, our activities and events, do visit our official website. Follow us on Facebook, Instagram, and Telegram. So don't forget to like, share, and comment our social media pages so that more people can benefit from our charitable work, including tonight's sessions, please. Right, so please like and share now. Now, tonight's session is part of the Let's Fight Cancer Together fundraising collaborative campaign between 365 CPS and OncoCare Cancer Centre. When someone seeks a consultation at OncoCare, you can actually be supporting this great cause. From mid-September all the way to mid-December, all proceeds from consultations of lung, gynae, and colorectal cancers at OncoCare will be donated to 365 CPS. For more details about this awesome fundraising campaign, please drop by our Facebook page or email us. Now, OncoCare Cancer Centre was established since 2007 and is one of the largest and fastest growing private medical cancer center in Singapore for adult patients. It has 7 centers and clinic island-wide, serving both local and foreign patients with evidence-based and personalized cancer care. Not forgetting, they are also an award-winning medical institution. Their services, treatments, and specializations are quite comprehensive and extensive, which are also claimable with the many government and private medical insurance providers too. Now, before we proceed with tonight's program, kindly note that all information shared at this session by the speaker and 365 CPS ask for general information only and subjected to changes. Do consult your doctor for personalized and detailed medical advice if you have any. We respect your privacy, so your questions should be something that we can share with the rest present here tonight. And everyone should have the chance to ask their questions too. So kindly make sure that your questions are limited, all right, to one or if not two, so that everyone have a chance to also ask their question later during the Q&A segment. Now, on tonight's topic, prevent, detect, and fight colon cancer. Now, colon cancer is a major killer in Singapore, common in both males and females. It is the top cancer in males and second most common cancer in females after breast cancer. Tonight, we'll learn how to prevent, detect, and fight it with a subject matter expert, Dr. Thomas So. Now, our guest speaker for tonight, Dr. Thomas So is a senior consultant medical oncologist at OncoCare Cancer Centre. With more than 15 years of experience, his main subspecialty is in the treatment of gastrointestinal cancer, including colon cancer. Now, without further ado, let's welcome Dr. Thomas for joining us tonight. Dr. Thomas,
Thank you,
welcome, and
Andrew,
thank
for
you,
your
Dr.
kind
Thomas, for joining
introduction.
us.
All right,
Yeah.
let
So,
me share my slides,
I will
and then
now
I can
hand the
start
time
off.
over to you, Dr. Thomas.
All right. Okay. Thank you, everybody, for joining us on a Saturday evening. So, as Andrew has said, today I'll be talking about colon cancer, how we are going to prevent, detect, and fight it together. So just a disclaimer slide before I proceed that I do not have any conflicts of interest. And the slides here are mainly for educational purposes. I do not claim copyright for any of the slides. They are freely available, the information on the internet. Importantly, this talk is not a consultation, yeah? So if anybody is unwell listening in and not sure, please go and see your doctor. So these are the questions that we'll be answering today. How common is colon cancer? How to know if I may have colon cancer and can I prevent or screen? And if I am diagnosed with colon cancer, what next? So how common is colon cancer? So I think before we answer that question, I think we also want to realize and understand what impact cancer has in Singapore. Cancer is the #1 killer in Singapore, and it has been so for the past decade. It can affect anybody, and it has been estimated that over the next decade, 1 in 3 people will die of cancer. Yeah. So this is the past few years cause of death in Singapore. So in general, we get about 60 deaths on average in Singapore. Interestingly, 20% of deaths, which is about 12 to 15 a day, is from pneumonia. But consistently, almost 30%, which is almost 20 patients a day, pass away from cancer. So the top cancer in Singapore for many years, right, at least this century, has been colorectal cancer. Now, in the past 20 years, colon cancer is the #1 cancer in Singapore when you combine males and females. If you break it up into gender, colon cancer is the top cancer that's diagnosed in males and the second most common cancer in females. On average, 5 to 6 patients a day are diagnosed in Singapore to have colon cancer. And if you look at the trend, this number has been very stable over the past few years. We are hoping that it will actually go down. A quarter of patients, unfortunately, are diagnosed in stage 4, right? So 75% are diagnosed with early stage, which is stage 1 to stage 3, right? And for patients diagnosed in this stage, they have actually more than a 75% chance that they will be cured. Now, for patients that are diagnosed in stage 4, if they are unoperable and if it has spread to many places, unfortunately, we may not be able to cure. But if it's localized and detected early, even in stage 4, we are actually still aiming to cure those. So 25% are diagnosed in stage 4, and we are possibly able to save 25% of these patients. But obviously, I think the purpose of this talk is to ensure, right, that we diagnose more patients in the early stages. So as you can see, in the past 20 years or so, the trend for colon cancer has been very stable. There are parts of the world and developed countries like the US where the incidence of colon cancer has been coming down, especially in the past 5 to 10 years. And that is because of screening and prevention, which I will talk about shortly. So we have made many advances in the treatment of colon cancer. So therefore, more people are now diagnosed with colon cancer, but they don't die from colon cancer. As you can see in terms of the mortality, all right, it has been coming down in the past 2 decades. I would say that prior to 1980, the true incidence of colon cancer as well as the true mortality may not be reflected. So you might say, hey, actually, in the 1960s and 70s, actually not many people die of colon cancer, but I would say then at that point in time, advances in imaging, advances in testing, advances in diagnosis was not as good as what we have now. Certainly, this downtrend in the past 20 years is a very accurate reflection that less people are dying from colon cancer, and we hope to bring that number ever smaller and lower. Now, how to know if I have colon cancer? So in general, when you see a doctor, it could be a family doctor, it could be a GP, it could be a specialist, it always starts with an interview, right? The doctor asks, right, what's wrong with you? So the doctor is hoping to understand whether or not you may have any symptoms. And after examination or by careful observation, he is hoping to identify any signs, right, that you may exhibit or show. So in general, I had mentioned 1 in 3 deaths caused by cancer. All right, this is a very nice summary in the Cancer 365 Cancer Prevention Society. And over at this pamphlet that they have, these are some of the symptoms on the left, all right, that actually may give certain warning signs. Unexplained weight loss, fever, fatigue, pain, skin changes, change in bowel habits, sores that do not heal, unusual bleeding or discharge, indigestion, change in bowel habits. Now, so this list is not specific or confined to just colon cancer, but in general, I think it is also important that we highlight that if a symptom is persistent, if a symptom is progressive, meaning to say that it is getting worse, or if there's pain that doesn't go away, then certainly you should seek help. All right, it doesn't have to be a specialist straight away. All right, you can see a family physician, but importantly, do see the same family physician, because usually when doctors encounter a patient that returns to see them with the same problem a second time, all right, he is more suspicious and he can actually escalate it, all right, appropriately. So please do not Dr. Hawk as well also. Now this slide is a very simple slide. Many patients do not have symptoms, all right? And this is not just necessarily confined to patients with early stages, but many patients with advanced stages as well also do not have symptoms. So it is important. Therefore, sometimes we do not necessarily have to wait till you are unwell to see a doctor. You should also see a doctor to discuss about screening. So therefore, the next question, how do we prevent and how do we screen for colon cancer? So again, another pamphlet from Cancer Prevention Society. All right, so let's talk about prevention first. In general, I would say it's important to maintain a healthy lifestyle. Everything starts from having a good body externally, but also internally. So a healthy diet is very important. In general, please eat, I would say, a diet that is well balanced. All right, so you should have the adequate amounts of fiber, good proportions of meat, carbohydrates in the necessary proportions. All right, it's important to include fiber in the diet because actually everything we eat, all right, may cause a certain degree of irritation inflammation in the bowels, especially they've done studies on red meat, preserved meat and all. It doesn't mean that you cannot eat those, but diet with just purely, right, concentrated in those have been shown to increase the risk of colon cancer. You want to reduce this risk as well and yet also enjoy your food. So therefore, all right, having adequate amounts of fiber decreases the amount of time all these bad substances accumulate in the intestines and flushes them out. The same can be said about exercise as well also. When we exercise, for example, if we do our walks, our running, our jogging, we actually decrease the amount of time that all these food remain in the gut. So you might realize if you've actually been regularly exercising, you tend to actually find that you go to the toilet to do your big business a little bit easier. Yeah. There are studies now done to show that actually the adequate amount of exercise for people to live longer is actually to do at least 150 minutes of exercise a week. Now, if you break it down, in general, this would translate to about 20 to 30% of exercise. What type of exercise are we talking about? Basically, it can be summarized by having certain degree of strain to your body. So imagine that actually, if you're actually just walking, you are probably still able to talk very well. But if you are actually walking a bit faster, all right, you may be able to talk in short sentences and still possibly sing. But if you're actually very, very vigorous, you definitely cannot sing. So in general, adequate intensive exercise means that any exercise that actually allows you to possibly maybe sing very shortly, right, or not sing at all. Yeah, so 20 to 30 minutes of exercise a day, all right, regularly. Okay, emotional health is definitely very important as well also. At 365 Cancer Prevention Society, they do offer counseling services as well, supportive services as well also, all right, for patients that are diagnosed with cancer. But I'm sure they are also happy to reach out for patients that are worried about having cancer or looking after patients with cancer. So what is screening? Screening refers to the testing of people for cancer in the absence of any signs or symptoms. All right. So importantly, screening aims to diagnose people, right, with early stage cancer and therefore increase the chance of cure. So in Singapore, all right, there are several ways to screen for the different cancers, not necessarily just for colon cancer. For breast cancer, there are mammograms, all right. For cervical cancer, there's pap smears, all right. There is a FIT testing, which is testing for fecal immunochemical testing. So in short, this is actually to test whether or not there's blood in the stools. And this is a different type of blood. Yeah, it's not fresh blood or that. It's actually blood that may not be seen with the naked eye, that may be embedded within the stools itself. So there are kits available, all right? You can actually get it from Singapore Cancer Society or actually from polyclinics. And sometimes when they are running campaigns for screening for colon cancer, it is actually available, all right, in pharmacies such as Guardian pharmacies as well also. So this is how a FIT test is done. In general, all right, try not to allow the stools to come in contact with water or urine. So put some toilet paper in front of the toilet bowl, all right. Then collect the stools onto that part, all right, under or on top of the paper. Twist the FIT kit, all right. Poke, all right, the stools multiple times, at least on 6 to 10 areas of the stool. Twist it back in, put it in a clean Ziploc bag that is actually provided, all right, in the FIT kit. Write your particulars, all right, including the collection date, and just mail it out, all right. So there are different organizations that does this. So Singapore Cancer Society does this. HSA as well also analyzes as well also. And if positive, they will then inform you that the test is positive and advise you to seek help, usually to actually consider doing a colonoscopy, all right, to detect or identify or screen for colon cancer. So what is a colonoscopy? All right, this is actually a procedure that allows a specialist to see inside the large intestines. All right, we use a very, very long tube, all right, like a hose, all right, and at the end of this hose is a camera, all right, and it actually goes in and records a video real time, live, like this Facebook Live now, and it actually allows identification of any swellings, tumors, or polyps. Using the scope, the doctor can remove tissue samples if he sees a tumor, or if he sees a polyps, he can remove those polyps as well also. So how is a colonoscopy done? All right, so in general, there's what we call a preparation, all right, where actually you are required to drink, all right, laxatives, all right, to clear the bowel. Now, a lot of people are worried about doing colonoscopies because, they will say that, wow, I have to drink 2 liters, 3 liters of this terrible tasting fluid, all right, and I have to go to the toilet all night just to clear it. Now, it is no longer as scary as having to drink 3, 4 liters nowadays. All right. Some doctors still prefer to use the old method of drinking at least 2 liters with some laxatives. But nowadays, there are actually small, what we call a small volume bowel preparation. So it's like a small bottle of a cough syrup bottle. Yeah. You just need to drink 2 small bottles of those, and you can actually drink 100 plus or even honey water, all right? And actually, the diarrhea that you get from doing bowel preparation for colonoscopy is not like the very painful type of diarrhea that you get when you have food poisoning, all right? When you have food poisoning, the tummy is very, very painful, all right? You break out into cold sweat, all right? You're aching. Now, when you are actually doing a bowel preparation for colonoscopy, in general, it just requires you to go to the toilet multiple times without that painful feeling, all right? It generally comes out and it cleans up pretty fast, okay? So this is actually important. Prior to actually doing the bowel preparation, the doctor will advise the person to avoid taking large amounts of fiber for 2 to 3 days prior to the procedure. All right. And so this would also make the bowel preparation or taking the laxatives much easier. The process of the colonoscopy itself is not very long. Yeah. In general, it takes anywhere between 15 minutes to 45 minutes to do the scope. Now, for patients that have a very clean colon without any polyps, all right, the whole procedure may be over between 15 minutes to half an hour. All right. For patients that have many polyps, the doctor will then remove the polyps slowly, one by one. All right. So that will take some time. But this is actually also a treatment process, right? Because all these polyps, all right, can potentially become a cancer if left inside. And the time taken for it to become a cancer may be anywhere between a few short years to most people, more than 10 to even 15 years. But in any case, if the doctor sees a polyp and removes it, then it will never ever become a cancer because it's out of your body already. So in this way, we actually prevent a colon cancer from actually happening. So who are those that should go for screening? In general, we would advise anybody above the age of 50 to begin colon cancer screening. It could be in the form of the fecal occult testing, the FIT testing, a colonoscopy, or a virtual colonoscopy where they don't insert a huge camera all the way into your large intestines. All right. Now, this age of onset of screening of 50 years old is just a guidance. There are many parts of the world that are considering bringing this age down to 45 or even 40 years old because we are actually seeing more and more young people being diagnosed with colon cancer. Yeah. For the stool testing, we advise it to be done every year, at least consecutively for 3 years. All right, you can have a few years of break after that, but then continue to do it again consecutively for 3 years. For colonoscopy, if the colonoscopy is clean, meaning to say there are no funny polyps, all right, then we advise the next scope to be as late as 10 years later. For virtual colonoscopies, we do it and recommend it to be done once every 5 years. Now, this is for patients with average risk, meaning to say there's no family history, they don't have any predisposing diseases or conditions. Yeah. Now, if there is someone in the family that's been diagnosed with colon cancer, then definitely the screening actually does start earlier, right? How early? Could be as early as 40 years old, or in general, at least 10 years prior to when the youngest person in the family was diagnosed. Yeah. If there is a history of polyps, yeah, instead of waiting for 10 years, sometimes the doctor may say, let's do one a year later, or actually 3 years later, depending on whether or not the polyps show any signs of early change. All right, polyps can change from just a simple growth to looking a bit funny and then becoming precancerous. Yeah, so the doctor will also advise accordingly if there are polyps that are actually removed. Yeah. Now, what makes someone at high risk of colon cancer? So there are certain conditions, all right, that, for example, predisposes a person to hundreds and thousands of polyps in the colon, and this is what we call FAP syndrome. So this is a rare syndrome, all right, but patients can have hundreds and hundreds of polyps, and because of so many polyps, they can also turn cancerous very easily. Yeah. So for these patients, we actually advise these patients to start colonoscopy as early as when they are actually teenagers, and they actually do it every year because their risk of colon cancer is so high. For the next condition, which is hereditary non-polyposis colorectal cancer, this is actually the most common type of hereditary colon cancer, meaning to say colon cancer that you can inherit or can be passed down from father to children. Yeah. In general, these patients have an increased risk after they are done with their puberty, their teenage years. So we actually advise these patients to begin colon cancer screening in their 20s. And because their risk is also higher, we advise them to do screening every 1 to 2 years. For patients with very, very severe inflammation of the large intestines, also known as Crohn's disease or ulcerative colitis. All right, this is not a very common condition in Singapore and in Asian patients, but we do have patients with inflammatory bowel disease. Yeah, so this is what it's called. So these patients, again, yeah, because the bowels and the large colon is always inflamed, their risk of colon cancer is high, and therefore the screening frequency also increases. So between colonoscopy and stool testing, FIT testing, which is better? Now, if you ask me, I'm biased. I would say colonoscopy is better, all right, simply because you are able to prevent colon cancer. You are able to also treat and remove polyps at the same time. Now, when we are actually doing screening on a large scale, meaning to say that if we are actually uh, a minister who says, okay, let's screen for colon cancer and say that, you can either choose colonoscopy or FIT, more people are likely to agree to do FIT because obviously it's less invasive, it's probably more convenient. And therefore, there was this large study to show, all right, that if I have two groups of people, one group that I offer colonoscopy to them, and another group that I offer FIT testing to them, the incidence and the pickup rate for colon cancer is the same for both groups. Not because colonoscopy is not better than FIT, or FIT is same as colonoscopy, but simply because people are less worried about doing the FIT, and less people are willing to go for colonoscopy. All right, but in terms of actually people that are willing to go for colonoscopy, right, they find and that patients actually reduce the incidence of colon cancer, all right, and their colon is definitely cleaner because we actually remove the polyps as well. Now, why do I talk about virtual and CT colonoscopy after talking about FIT and just colonoscopy alone? It's simply because I understand that many people are worried about doing a full colonoscopy. So there's this thing called a virtual colonoscopy as well also, all right, that involves someone doing a CT scan, all right. There's still a same preparation, yeah, so you still have to drink the laxatives, you actually still have to go and purge out. And then when you do the scan, they will insert a small little rubber tube to actually make the large intestines slightly more swollen so that you can actually identify polyps. Again, while this is an option, my preference is still, all right, for someone to go for a proper colonoscopy because you can see that actually the polyp is not removed. The polyp is still there. Yeah. So this is what I was talking about. Okay, there are large scale studies to show actually that if you do a colonoscopy, you actually reduce the chance of getting a colon cancer. All right, so it's not just about detecting early colon cancer so that you can actually have a higher chance of cure, you know. Among all the different cancers that can be screened in Singapore, all right, colon cancer is one of those that can actually be prevented. Yeah, all right. I don't think there's any other cancer where you actually do a procedure, you actually reduce the chance, all right, of getting cancer itself. You see, for mammograms, for example, for ladies that do mammograms for breast cancer screening, the mammograms do not prevent breast cancer. All right, it increases the chance of detecting early breast cancer, all right, and therefore increase the chance of cure. All right, but mammograms don't prevent breast cancer. So colonoscopy prevents colon cancer. Yeah, I think the only other cancer that can be prevented, all right, are actually liver cancer if you are vaccinated against hepatitis B, or cervical cancer if you are actually vaccinated against the virus that causes cervical cancer. Yeah, so those are actually through vaccinations, right? So this is actually through doing a procedure to remove polyps and precancerous lesions. Now, what about tumor markers? Yeah, because nowadays, right, many doctors actually do tumor markers, which is a very convenient way of doing blood tests for screening. Yeah. Now, the Ministry of Health does not actually routinely recommend screening for cancers with tumor markers. Yeah. The reason is that usually when we do blood tests, tumor markers are not very sensitive. Tumor markers are not very specific. What do I mean? The most common tumor marker that is raised in colon cancer is this marker called CEA, right? In normal people, all right, the CEA shouldn't be more than 3, right? In smokers, it could be as high as 3.5 or 4, but it shouldn't exceed 5. Now, CEA can be raised, yeah, in up to 20% of smokers, and even normal people without cancer, about 3 and up to 5% of people can have a high CEA. Now, importantly as well, all right, less than 1/4 of patients with early stage cancers do not have any raised CEA, and even patients with advanced colon cancer, all right, 25% of these patients, all right, may not have a high CEA. CEA can also be raised in many other conditions such as inflammatory bowel disease, gastric ulcers, liver cirrhosis or liver hardening, pancreatitis, hypothyroidism, pregnancy, right, food poisoning, very bad constipation. Yeah, so when we see a CEA that is borderline high, out of 250 of these patients with a borderline high CEA, meaning to say a CEA of between 5, all right, to 8, yeah, only one out of 250, all right, are what we call true positive. So 249 patients out of 250 worry, do I have a cancer? Do I have colon cancer? But in the end, it turns out to be nothing. CEA is also not very specific to colon cancer. All right, could be raised in breast, lung, gastric, pancreatic, all right, even tongue cancers or mouth cancers and many others. So it's also not very, very specific. So cancer markers, we still use it nowadays, but what we do is, for me as an oncologist, CEA is used more as a tool for follow-up. All right, cancer markers are very good markers in the presence that I already know that there is a cancer. So for example, if I have a patient that's already confirmed to have colon cancer, all right, I treat the colon cancer, all right, with surgery, with chemotherapy, and the CEA goes down. That is its true value and main use, yeah, to actually follow up the patient long term, rather than just pick 100 people on the streets and do CEA for them and try to identify a cancer, which is actually what screening is about. Try to identify tumors in well people. Now, the big question, so someone has been diagnosed with colon cancer. So what next? So in general, how do we diagnose colon cancer first? So we usually diagnose colon cancer through a colonoscopy and biopsy, where we actually sample a bit of the tumor, all right, to get some tissue and confirm under a microscope that there is cancer. We also want to know what stage the patient is, so therefore we do scans for the patient to see if it is confined just to the colon or if it has gone to other parts of the body. Now, if it has gone to other parts of the body, one option is to actually sample that organ. For example, colon cancer most commonly goes to the liver. We might be able to put a needle into the tumor, all right, in the liver and sample that. Regardless, most doctors will still advise doing a colonoscopy, all right, to actually look at the original tumor in the colon, because we also want to establish whether or not the patient is going to be in danger of an emergency, such as a complete block or obstruction, or if the tumor is obviously bleeding internally and quietly, right, for a patient that has a very low blood count. So I'm not going to go into very, very specific details. This is more for education, and every person's treatment, all right, nowadays is personalized, all right, and it's actually tailored specific to the patient. But in general, for early stages, which is stage 1 to stage 3, our main intention is to actually cure the person, all right, and this is actually done through operation, surgery, and chemotherapy. Now, chemotherapy can be given before or after surgery, all right? And radiation is usually reserved for patients with very, very low tumors in the rectum, where actually we are worried about the margins, yeah? When we operate on a tumor, we also want to get an area around that is free from cancer. And in the rectal area, usually because there's a lot of fat around there, rather than the colon, which is actually has nothing at the side, yeah? So in order to clean that area up a bit, we do actually discuss radiation for patients with tumor that is slightly thicker. Now, if the tumor has spread, which means that the patient is stage 4, we actually still divide the patients from a practical point of view into 3 groups. The first group, which is palliative, because the tumor has spread to many, many areas, right? The lung, liver, bone, all right? These patients are what we call palliative, where we hope to control rather than cure. And with palliative chemotherapy, patients nowadays do not live for just months, they actually live for years as well. Now, the next group is actually curative, all right? There is actually about 25% of patients, even in stage 4, that can still be cured, all right? And that's because, maybe one small little tumor has gone into the liver, and through a combination of removing, all right, that tumor that has spread, as well as the original tumor, and giving chemotherapy, possibly radiotherapy as well if needed, all right, we are still able to cure these patients. And of course, there are some that are what we call potentially curative, where maybe initially it is not operable yet, but if we are able to shrink the tumor, all right, remove as much of the tumor as we can through chemotherapy, and then change the patient from non-operable to operable. So therefore, these patients are still potentially curative. Now, these are the different medications and different types of treatment that we use for colon cancer. In general, most of them are chemotherapy, all right, but we do actually have a lot of antibodies or targeted therapy, all right, against certain mutations that are present or absent in colon cancer. So we are able to detect mutations nowadays by testing the tumor sample. We also have immunotherapy for a small percentage of patients that are suitable. Now, in the past, prior to year 2000, the list is only made up of 1 to 2 medications, believe it or not. All right. Fast forward 20 years later, this list has now expanded and is expanding. All right. There are now new agents that are being studied for previously thought to be resistant mutations that are actually up and coming. So we hope that patients can live longer even if they are in the palliative setting. And definitely, if we diagnose more patients in the early stages, we can cure them. So after surgery, after chemotherapy for the early stages, what next? So the first 3 years are the most important, right? We watch the patient very closely for the first 3 years, because if the patient relapse in the first 3 years, all right, okay, then we are still able to potentially try to cure them. We get a second chance for many patients. They are watching closely, all right. And it's been shown as well also, if patients don't relapse in the first 3 years, there's a very good chance that they live beyond 5 years, or what we call the cure after 5 year mark. Yeah. So therefore, for patients that have had treatment with colon cancer for the first 3 years, every 3 months, we'll actually get him to see a doctor, see an oncologist, or see the surgeon, do scopes, do blood tests, do scans, yeah, just to watch the patient very closely. So in summary, colon cancer is very common. Yeah, it is curable in the early stage and even in some stages of stage 4. Um, it is preventable. Yeah, remember what I said about colonoscopies removing polyps. So start screening when you can. So when you are actually at the age of 45, 50 years old, please remember, all right, that colon cancer can be screened. You don't have to wait for symptoms. All right, it's more important, right, to actually detect, right, even in the absence of symptoms, yeah, and also prevent it. So start screening when you can. Yeah. So this is my last slide. So I'll now hand the time over back to Andrew, yeah, and go for the Q&A. Thank you.
Right. Thank you very much, Dr. Thomas, for the very insightful and informative content. I hope everyone has picked up some useful tips earlier on. Right. Remember, folks, early detection saves lives. Right. So, Dr. Thomas has also mentioned about our counseling service that we offer to our members and patients. I'm also pleased to tell everyone that our counseling services are also available to non-cancer patients, right? So to take care of your mental wellness. So if you are keen on, knowing more about counseling services, do contact us. Now, Dr. Thomas, you also mentioned about colonoscopy and FIT. So coincidentally, I did colonoscopy a few years back and also recently for FIT. I must say, just like I totally agree with you, it's not so scary and, not so offensive as many makes it out to be. I think before I go there, I wish I would have gotten to know about this session first before I go for it, because people around me was telling me all the horror stories and all, and actually it's something quite simple and straightforward. It's not so scary. So for those who are considering going for a colonoscopy or already booked for one, and also it's time for your FIT, I really encourage everyone to please go forward with it. And yeah, there's certainly nothing to fear. Now, so once again, we have seen so-called quite a number of questions already. Yes, thank you, Bilay or Tan Bilay. Yes, there's two Mr. So here. One is a doctor, one is not. Now, probably one of the questions many will ask is, are we two related? Sorry, we are not, but we are certainly related because we are from the same soul clan, right? So that's about our relation, right? So now, really, let's get on with the Q&A segment, because we've seen many questions coming. And first up is our ardent follower and fan, William, from all the way from Indonesia. So I guess his question is, at the top of everyone's mind. I think he's just a foodie, just like all of us. His question is, what kind of food and drink not are we not supposed to eat? In order to prevent colon cancer. Right, Dr. Thomas, over to you.
So, William, I hear you are a foodie, right? So, really, I think it is important to still enjoy your food. Yeah. All right. The key thing is actually moderation and having a sensible diet. Yeah. So, as you could remember, part of my talk was actually talking about having adequate amounts of fiber in your diet, reducing the amount of red meat, reducing the amount of preserved food. Now, it doesn't mean you cannot eat your steak if you like steaks, yeah, but you shouldn't be taking steaks every day, yeah. Um, Exercise, not just diet, is as important, right? At the end of the day, overall healthy lifestyle, yeah. So too much of a good thing is bad. A little bit of bad things, if you're actually eating sensibly, right, most of the time, is actually okay. Yeah. So please do enjoy your food, get good amounts of exercise, drink plenty of water, right? It's okay to go for your wine and dine now and then.
Yes, that's right. Thanks, Dr. Thomas. Yeah, I think the key word here is really in moderation. I mean, and nowadays we have heard of terminologies like cheat days and what have you not. I mean, it's okay to indulge once in a while, but don't overindulge because the so-called after effect, is not something that you want to regret it. Now, I think William has quite a few more questions, but I think Dr. Thomas have already answered them, in his so-called presentation earlier on, and some are a bit too personal to answer them openly here. So I seek your understanding, William. So if you still have further questions on those questions, yeah, please feel free to email us. Now, the next question we have is from Ting, right? So her question is, instead of doing bowel prep, is there any other way to colon cleanse, like perhaps enema, Dr. Thomas?
Okay. So when we were talking about bowel preparation just now, it is actually very specific as a preparation for a colonoscopy for the doctor to be able to look inside a clean colon and to also be able to identify polyps clearer. This is very different from a lot of healthy spas or alternative medicine or wellness spas that actually advise about colon cleansing. Yeah, those type of colon cleansing, they do it in a variety of ways, like maybe enema, for example. They even pump coffee up the rectum, yeah, the backside and all that. Now, so that type of cleansing is very different and actually at this point in time has not been proven, right, to reduce colon cancer risk. All right. So that's a different topic altogether. So when we were talking about colon cleansing or bowel preparation, it's really more for the specialist that's doing the endoscopy to be able to identify, plug the polyps. Yeah. Again, enema and all that, they don't remove polyps. Yeah. So don't reduce the chances of colon cancer.
Yes, Dr. Thomas. Yeah, remember, folks, talk to your doctors, right, for the right treatment and the right advice. There's a lot of myth and misconception out there, and some would even say even those type of snake oil treatment. So yeah, talk to your doctors that they would be really the subject matter expert to really advise you. Now we have a question from another of our fan tonight, Frostbite Cool, right? His question is, why every time constipated for a week and then when I eat, stomach is painful, and then what are the fruits and vegetables that naturally is able to cleanse the bowels, right, Dr. Thomas?
I think it's important to realize that everybody is different. Yeah. Some people can go to the toilet every day. They can eat, just no vegetables and they still go regularly. Some patients, they can eat all the vegetables they want and, they only poo once every 3 days, for example. So I think it's important to realize that everybody has different bowel habits. Yeah. So there's no real right answer what is a good normal frequency. But what we doctors look out for is actually a change in bowel habits. Yeah. What do we mean by that? So a change in bowel habits would be, for example, if someone used to go to the toilet, every 2 days or even every day. Now, then slowly he stops going every day, right? He has diarrhea every 3 days and constipation every 2 days. So this is what we call a change in bowel habits. And it's one of the signs we look out for because as a tumor grows, it actually narrows the passageway of the colon. Yeah. So as it narrows, stools can't pass, so they get constipated. Yeah. And the pressure builds up behind, all right, after 2 days, 3 days, and then the high pressure pushes the stools through and then they get diarrhea. So this change in bowel habits is actually more worrying rather than having so-called an ideal frequency. Yeah. So if you think that there is a change in bowel habits, please do seek treatment or seek advice, yeah, from your family physician, yeah, who may then refer you on to a specialist.
Yeah, that's right. When it comes to bowel movements, some people I've heard of kind of relate it to like our expressway. Sometimes PIE jam, but ECP, smooth flowing and so on. That's why our government LTA also have the EMAS, so that to have advance notice to drivers to avoid those jam areas. So in a sense, for your bowel movements, yes, everything is possible. But if you really, really feels that you are a bit uncomfortable and a bit iffy on the conditions, yeah, once again, pay a visit to your family doctors or to a specialist to have it checked out, right, for at least a peace of mind, right? Okay, guys, now we have a question from Yuko Yo, right? Her question is, often having constipation, will it land up or lead up to colon cancer? My gosh, that sounds serious.
So again, remember the previous answer, yeah, about change in bowel habits. So we're more concerned about change. But certainly, if someone is frequently constipated, there is potentially a slightly increased risk of colon cancer simply because of this concept of transit time. So meaning to say food takes longer, all right, and spends a longer time in the large intestines. Now, food is not necessarily pure, right? There could be a lot of chemicals inside or irritants. Yeah. So this irritation, all right, can cause inflammation in the large intestines, and the inflammation can increase, all right, the chances of polyps forming. Yeah. So if someone is frequently constipated, I would say then this someone, all right, needs to actually then consider doing regular colonoscopies, right, every 5 to 10 years, all right, to identify polyps. So constipation doesn't straight away cause colon cancer. Yeah. Colon cancer invariably is a very predictable cancer. You get polyps first, the polyps get irritated, they change, all right, they turn funny, and then they become colon cancer. And the good thing is that it takes time for this process to happen. Yeah, so if you're not very happy with your bowel habits and all that, then you can do something about it rather than worry about it, causing colon cancer. Go for a scope. Yeah, you remove the polyps, all right, which are the precancerous lesions. All right, then you don't have to worry about that polyp ever becoming a cancer.
Thanks, Dr. Thomas. I think we have a follow-up question from Frostbite Cool. He says that he has actually paid a visit to the doctor and was only given laxative, right? Still painful when eating food. So any additional advice on that, Dr.
So the
Thomas?
important thing is go back to the same doctor. Yeah. If you go back again, it has a very different effect if you are to change a doctor because you didn't think that the first doctor was good enough. Yeah. So if you go back again, right? And if you go back again, all right, that doctor is gonna start getting worried, and then he might also have a higher index of suspicion whether or not there could be something going on, especially if there are certain risk factors and all. Then he will refer you on to a specialist.
Mm. Thanks, Dr. Thomas. Now we have another question from Edna Lim. Her question is, are the polyp removed? I suppose she's asking whether it will reoccur after the polyps are being removed.
Okay. So the polyps are removed by putting a snare around it. So imagine like a cowboy, a lasso, yeah? So it actually puts it, and that is either heated or cooled. So usually nowadays they do cold snares, yeah? So pretty much the polyp is removed, yeah? Now that polyp is not just removed, it's actually sent for testing. And the testing is done under a microscope to see if any of the cells are suspicious, any of the cells are precancerous or even cancerous. Now, if the cells are cancerous, then obviously the doctor will then talk about surgery itself to remove it, because then it may not be clean, right? Just a snare alone may not be clean. Now, if they are actually just funny looking or suspicious, usually that's where the doctor will then repeat a scope, all right, within a year, just to make sure that nothing is growing out of that again. Yeah, but certainly also new polyps can form. Yeah, that's how that polyp grew in the first place. So there are new polyps that can form elsewhere. So therefore, the colonoscopy should not just be a one-off event. Even if the colon is clean and not have any polyps, then the next scope should be done in 5 years or 10 years, depending on the doctor advice.
All right. Now we have a next question from Jessie Ng. Uh, Hi, doctor. When should I need to go back to do colonoscopy, as my colon surgeon already discharged her last year, and I have a permanent stoma and already 6 years in surgery, or should I just go for FIT for these two tests? Dr. Thomas?
So if someone has been diagnosed with having colon cancer, um, and depending on the type of surgery done, because some surgeries involve removing the entire colon, yeah, some surgeries involve just removing part of the colon. So most surgeries involve just removing part of the colon. Now, if only part of the colon is removed, then the advice is to do lifelong 3 yearly colonoscopies. Yeah, if you remember one of my slides, under the moderate risk part, yeah, a personal history of colon cancer, if you actually sharp enough to pick up, there was actually a recommendation there that these patients should actually have a 3 yearly colonoscopy. So perhaps in your case, maybe there are other reasons, but you can actually clarify with your surgeon if actually follow-up colonoscopies need to be done. Yeah, because there are different types of surgeries and different risks as well. Also, once a person has been diagnosed with colon cancer.
Okay, thanks, Dr. Thomas. I guess there's a few questions that kind of so-called circle around the topic about food that we take, whether they are a bit more high risk to colon cancers and more colon cancer causing, because these are very quite synonymous towards certain nationalities or cultures. Say, for example, talking about barbecue food, or so-called grill food, right? So does food like barbecue food and also stuff that is being grilled increase our risk of having colon cancer?
So again, Andrew, the key thing is moderation. Yeah. So we know grilled food, barbecue food, all this increases the risk. Yeah. Red meat, right? Lack of fiber, all these increases the risk. But again, the grilled food does not directly cause colon cancer immediately. Yeah, again, it's a very predictable transition from the barbecue, the carbon, the grill, whatever chemicals inside the food. All right, so very predictable stepwise progression where there's irritation in the large intestines. That irritation causes polyps. That polyps then takes time to become colon cancer. So again, it's not that you cannot enjoy your barbecue. It's not that you cannot enjoy your wine and dine. All right. go for your scopes.
All right. Yeah, see, doctor also says that go for your scopes, right? If you want to be sure and want to be safe. Now I mean, due to the time, we'll just take one last question. I think it is a very useful question for you know everyone here. I think the question is from Frostbite. Is asking what is the cervical cancer vaccination called, Dr.
Okay,
Tom? Mm.
so basically for cervical cancer, um, the vaccination is against this virus called HPV or human papilloma virus. All right. In general, it's because there are certain subtypes of HPV that causes right cervical cancer. Um, Now, this vaccination is done usually for young ladies, young girls. All right. That's because the virus is actually sexually transmitted. All right. It is not a sexually transmitted disease, but the way it is actually transmitted and increases the risk of cervical cancer is actually through sexual contact. So therefore, the vaccination is best done, all right, in teenagers or even young adolescent girls who have not had sexual exposure yet. Yeah, there are different brands on the market, all right, for vaccinations against HPV. Different family doctors actually do carry different brands, so you can actually check with the family physicians as well also. But in general, they are actually against HPV strains number 11 or 16, if you must know the details. And it's actually given more to younger ladies, simply because of you want to actually prevent the virus exposure in the first place. If you've already been exposed to the virus itself, then that vaccination doesn't reduce right the risk of cervical cancer then. So it's usually done for ladies before the age of 20 or before they actually are done with secondary schools and all that.
Right. Thank you, Dr. Thomas, for answering all the questions. And we certainly apologize to those who have posed your questions that we are unable to answer them in the segment now during the Q&A, and mainly also because of the nature of your questions and also the guidelines that we have for our Q&A segment. So yeah, once again, thank you, Dr. Thomas, for your time and also your sharing for being with us tonight for tonight's talk sessions, and of course everyone for your enthusiastic participation. So we hope everyone has enjoyed tonight's sessions and gained much knowledge about colon cancer. But before we go, we like and of course appreciate everyone to give us your feedback for tonight's sessions and what other topics that you would like us to feature in the future. So we have the QR code on screen now, right? So please take a couple of seconds to scan it and provide us with your feedback and suggestions. All right. So for our next Facebook Live talk session for November, right, will be on pancreatic cancer, the invisible killer, right? So this session would be in Mandarin. You can find out more on why it is known as the invisible killer and why the survival rate has improved in the last decade. Now, the speaker and the session's details are currently posted on the screen right now. So the session will be held on the 20th of November at 8 p.m. once again over on our 365 CPS Facebook page, right? So do join us, and of course to share the information with all your friends and your kakis so that more could get to know uh, more about this topic. Now, lastly, for more information and to stay up to date about 365 CPS, our activities and events, do visit right our website, right? Follow us on Facebook, Instagram, and Telegram. And don't forget to like, share, and comment on our social media pages so that more people can benefit from our work, right, in fighting and educating think about cancer. Now, once again, thank you very much for your participation, and of course, Dr. Thomas So and OncoCare Cancer Centre for being with us tonight. Now, stay safe and good night. Thank you.